This exercise I'm going to show you is a bit more advanced. So for those of you who have never worked with a foam roller, it is great for core and for balance, but there is a chance, of course, of falling off, although you're only going to drop 6 inches to the floor. So you can do these exercises I'm going to show you on the floor first, and you can also purchase a foam roller that is flat on the bottom, so you have the dome on the top if that makes you feel safer. But I am using a 6-inch diameter foam roller, and it is 3 feet long, so that supports me from my tailbone to the tip of my head. Now this exercise, for somebody who has undergone any type of abdominal surgery, particularly if a muscle's involved, like in an abdominal TRAM, it is so beneficial to work the core musculature even when you're not able to do crunches, whether it be there hasn't had enough healing time yet, or your rectus abdominis is now located in your breast, so it makes no sense to do it. But bear in mind, if you have undergone an abdominal TRAM, you will have a very difficult time rolling yourself back, and if you've had a bilateral TRAM, you probably won't even be able to, or rolling up. So in that case, you'll do what I'm going to show you, which is rolling up on the side. And that's probably the best way for most people to learn how to do this anyway. So I position the end of this under my tailbone, and this may not be graceful, but I'm just going to kind of scooch myself back so that my head and my spine are supported on this foam roller. My feet are parallel and my legs are roughly at 90 degrees. Now I can put my hands behind my head if I want a nice stretch in my chest, or if that's too much, I can just rest them here. I'm going to choose to bring my arms out here because it actually helps me balancing. So what I'm going to do is I'm going to get up on my tiptoes and I'm going to start marching. Now you can see me wobbling, I'm exaggerating a little bit. You want to minimize that as much as possible. So I'm pulling my belly button towards my spine, and then if you can do this with relative ease, then go ahead and try and walk your feet a little further away. And you'll probably feel a little more unstable. Then bring them back in and keep doing this. So the further away the feet go from the midline of your body, the more you're going to feel these muscles become engaged. And, you know, do a couple sets of those, whatever you feel comfortable with. You certainly don't want to do it when you're feeling very wobbly. If you're good at that and you want to take this up a notch, this requires a good amount of balance. Arms are out to the side, belly button drawn in, and you're going to raise one leg up. It's best if you look at your toes or up at the ceiling. And you're going to hold this thigh parallel with the other leg. Try and hold it for 5 seconds and then relax. And then do the same thing. And notice how unstable I am on this side. It's because the other side is my dominant leg. So I have to work much harder on that second leg, and you might find the same thing, and that's okay. You may need to spend a little extra time, and if your leg tends to fall over to the side, think about pushing it inward so you're controlling how much movement takes place. But great exercise for core and balance. Let me reiterate, to start on the floor, make sure you're comfortable with it, and then move up to the foam roller. If you have any pain, if it causes you pain in your low back, you're probably not engaging your abdominal muscles properly, and maybe you need to start with something a little easier to begin with.